So, a very good afternoon to all of you. So, I'm back again over here with top 200 questions या मैं कैसे बोलूँ most expected 200 questions. ठीक है? तो जैसे कि आप सबको पता है कि we have been together in this journey from a long time. So now जो top 200 questions हैं उसमें सबसे पहले आप ऐसे कुछ क्वेश्चंस फाइंड करेंगे जो कि हमने पहले कर चुके हैं बट देन you know the intensity or the importance of those earlier questions also वो भी मैंने इसमें इंक्लूड करे हैं प्लस कुछ ऐसे क्वेश्चंस जो कि हमने नहीं करे ओके सो इट्स अ मिक्स बैग ओके तो अगर आप लोगों ने पहले वो क्वेश्चंस कर चुके हैं तो उन्हें वापस करिएगा ओके क्यों क्योंकि वो क्वेश्चंस इंपॉर्टेंट हैं ठीक है सो हेंस दोस क्वेश्चंस आर वेरी वेरी इंपॉर्टेंट वी नीड टू डू दोस क्वेश्चंस सो यस good afternoon beta good afternoon Falguni good afternoon Naman Sanya everybody good afternoon so yes again a reminder if you have done these questions earlier do it again because this is why and this is why कि इतने important questions हैं वो okay so yes so this is one session for top 200 questions और इसके बाद हमारा एक 1:15 से एक सेक्शन है जिसमें हम एक 50 क्वेश्चंस लाइक एक छोटा सा पेपर probably डिस्कस करेंगे ओके सो यस आई नो यू वर वेटिंग फॉर मी थैंक यू सो मच सो या let us begin with it first. Naman, let us start with the hi Roshni, good evening, good afternoon. पहले let us start with this particular question, sorry, this particular session. उसके बाद हम चालू करते हैं, ठीक है? तो just a minute till then, let me just tell you. Wait. हाँ सो गुड आफ्टरनून अगेन एवरीबॉडी लेट मी जस्ट टेल यू कि आप लोग मेरे साथ में क्वेश्चन सॉल्व करेंगे ओके हेलो जयश्री हेलो एवरीबॉडी गुड आफ्टरनून और आई वांट ऑल ऑफ यू टू राइट इन योर चैट बॉक्सेस ठीक है गलत ही होगा ना ज्यादा से ज्यादा कोई बात नहीं चलिए लेट अस बिगिन पहला क्वेश्चन चलो रवि अंडरस्टैंड्स पीपल्स इमोशंस वेरी वेल and is also aspiring to help humanity, he is more likely to succeed as what? Very easy. He is more likely to succeed as easy. He is definitely more likely to succeed as a psychologist. So option number A. ठीक है? चलिए. Now, in the context of Freud's theory, the unconscious is not directly accessible but influences the behavior. Okay, which method did Sigmund Freud not use to explore the unconscious? तो भाई free association use किया था Sigmund Freud ने, है ना? Sigmund Freud की ही थी psychoanalytic therapy. Okay, ड्रीम एनालिसिस भी यूज किया था उन्होंने डायरेक्ट इंटेरोगेशन इंक्लूड नहीं किया था right hence it is direct interrogation okay which disorder is characterized by significant distress or impairment related to a perceived defect or flaw in physical appearance which is not observable or appears slight to others सबसे पहले significant distress and impairment ठीक है क्योंकि significant distress और impairment लिखा हुआ है यहाँ पे तो ये क्या हो सकता है यस देखो सबसे पहली बात इंपेयरमेंट मतलब लॉस ऑफ अ बॉडी पार्ट ठीक है लॉस ऑफ अ बॉडी पार्ट तो अगर मैं लॉस ऑफ द बॉडी पार्ट की बात करूं या मतलब एक बहुत डिस्ट्रेस का मोड आया स्ट्रेस का मोड आया ओके और लॉस ऑफ द बॉडी पार्ट में आया तो दिस इज द कन्वर्जन डिसऑर्डर बेटा दिस इज नॉट बॉडी डिस्मॉर्फिक दिस इज कन्वर्जन डिसऑर्डर ओके Now, why might individuals exert less effort when working in a group compared to working alone in the context of social loafing? ठीक है ये सोशल लोफिंग की बात हो रही है क्यों इंडिविजुअल्स ऐसा क्यों करते हैं ठीक है चलो दे फील दैट इंडिविजुअल एफर्ट इज लेस आइडेंटिफाइबल दे बिलीव ग्रुप टास्क आर लेस इंपॉर्टेंट देन इंडिविजुअल टास्क दे आर लेस मोटिवेटेड बाय ग्रुप गोल्स दे प्रेफर टू वर्क इन अ मोर कम्पिटिटिव एनवायरनमेंट तो हमें देखो एक चीज याद रखो ऐसे क्वेश्चंस में ना, अच्छा आपको भी जहां लगे कि मैम इसके ऑप्शन दूसरे भी हो सकते हैं, यू कैन डेफिनेटली टेल मी एंड आई विल अलाउ दैट, ओके, क्योंकि डेफिनेटली दूसरे ऑप्शंस भी हो सकते हैं, राइट? सो यस, देयर इंडिविजुअल एफर्ट इज लेस आइडेंटिफाइबल, मगर अगर कोई इंसान यू नो ये बोले कि लेस मोटिवेटेड है ग्रुप गोल से, हम कर सकते हैं उसको, ओके क्यों? क्योंकि डेफिनेटली आइडेंटिफाइबल ही नहीं है, बट इसका इसका करेक्ट आंसर है ए। चलो, हाउ डज द इंडियन कल्चरल पर्सपेक्टिव ऑन सेल्फ डिफर फ्रॉम दैट फ्रॉम द वेस्टर्न पर्सपेक्टिव? ठीक है, तो द इंडियन पर्सपेक्टिव एम्फसाइजेस इंडिविजुअलिज्म ओवर कलेक्टिविज्म, बिल्कुल नहीं। द वेस्टर्न पर्सपेक्टिव एम्फसाइजेस फिक्स्ड बाउंड्रीज बिटवीन सेल्फ एंड अदर्स। The Indian perspective values detachment and disengagement from social relationship, nahi. The Western view prioritize relational bonds over personal achievements, no. The option, correct option is B. Okay. Now, in the context of schizophrenia, auditory hallucinations are more common. Okay. What does this symptom entail? ठीक है, ऑडिटरी हेल्यूसिनेशंस की बात हो रही है। हेलो खुशी, हाय हाय, गुड आफ्टरनून एवरीवन। ऑडिटरी हेल्यूसिनेशंस की बात हो रही है यहाँ पे, ठीक है? तो सीइंग थिंग्स दैट आर नॉट प्रेजेंट, बिलीविंग इन फॉल्स पर्सनल नैरेटिव्स, hearing voices or sounds that are not actually present, या feeling sensations on the skin without a physical cause। तो स्किज़ोफ्रेनिया और ऑडिटरी हेल्यूसिनेशंस की जहां पे भी जाके बात होती है, वहां पे हियरिंग वॉइसेस और साउंड्स दैट आर नॉट एक्चुअली प्रेजेंट। सिंपल एग्जाम्पल, मैंने इवन जब मैं आपको पढ़ाती हूँ, मैंने आपको हमेशा एक चीज याद दिलाई है, एक चीज मैंने ध्यान में आपको रखवाई है कि हमेशा एक चीज याद रखिएगा, ऑलवेज रिमेंबर द मूवी ऑडिटरी हेल्यूसिनेशन, द मूवी फिर हेरा फेरी एंड हेरा फेरी। उसको जब साउंड्स वो साइन करने जाता है, उसको कुछ सुनाई आता है एक गाना, राइट? दैट्स ऑडिटरी हेल्यूसिनेशंस फॉर यू। Which of the following best represents, which of the following, just a minute, yeah, which of the following best represents the concept of self-efficacy? Okay, the belief that one's personality traits are fixed and unchangeable, the confidence in one's ability to organize and execute actions required to manage the prospective situation, the extent, okay, the extent to which an individual values themselves in a social context, yeah, the ability to control one's emotional states and impulses. Yes, Shrishti, because these are the most important ones, that's why, okay, hence you have to do it again, right? So the correct option is B. Now, what is the role of norms within a group context? What is the role of norms within the group context? To individualize members' behavior, to regulate and standardize the behavior of members, to create a hierarchy within the group, या to encourage competition among the members. तो norms क्यों होते हैं group context में? Yes. Why do you have norms in the group context? Just a minute. Yes. What do you all think? Yes, to regulate and standardize the behavior of the members. Okay. If an individual has a strong sense of their personal and social identities, which psychological construct does this primarily relate to? If an individual has a strong sense of personal and social identities, कौन सा psychological construct है ये? उसकी पर्सनल आइडेंटिटी और उसकी सोशल आइडेंटिटी बहुत स्ट्रॉन्ग है, तो ये क्या होगा? कैन एनीबडी टेल मी? यस, वेरी वेरी स्ट्रॉन्ग सेंस ऑफ पर्सनल एंड सोशल आइडेंटिटीज। ओके, तो कोई बोल रहा है सेल्फ कॉन्सेप्ट, इज इट सेल्फ कॉन्सेप्ट एवरीवन? Yes? Okay. Okay, considering the stages of group formation, what is the storming stage characterized by? Storming, of course, जहाँ पे conflict हो, वो storming है. So we all understand conflict among the members regarding the group's direction and leadership. Okay, that is what storming is. right? Chalo. When assessing the dynamic of a group based on Tuckman's stages of group formation, which stage directly follows the initial forming stage where members are excited but apprehensive? Forming के बाद कौन सी stage आती है? Yes. What stage comes after forming? Very easy. Forming के बाद तो storming आती है ना, उसके बाद norming आती है ना? राइट right? तो अगर मैं यहाँ पे सारी स्टेजेस के नाम लिख दूं, फॉर्मिंग, स्टॉर्मिंग, नॉर्मिंग, परफॉर्मिंग, adjourning, right? These are the 5 stages. Which category of psychological disorders is characterized by the experience of intense terror, often described as panic attacks? Intense terror, often described as panic attacks. So definitely intense terror तो इसी में होता है ना? Anxiety disorders में हो सकते हैं because panic is also part of anxiety. ओके जहां पे बहुत डर लगता है एंड सडनली यू ऑल बिकम पैनिकी. Group polarization tends to occur because why? Individuals seek to align with less popular opinion within a group. Group discussion strengthens the group's initial dominant position. Groups naturally prefer conservative decisions over extreme ones. Individuals in a group are less likely to express their personal opinions. So group polarization कब occur होता है? कोई बता सकता है? When does group polarization occur? Yes? Anybody? Where individuals seek to align with the less popular opinion within the group. Group discussion strengthens the group initial dominant position. Naturally prefer conservative decisions. या individuals एक group में they are less likely to express their opinions. It is B. Okay, considering the 5-factor model of personality, which trait would likely describe a person who is inventive, curious, appreciates art and adventure? Inventive, curious, appreciate art and adventure. सबसे पहले तो ये ओशियन मॉडल है, ठीक है? तो अगर ये ओशियन मॉडल है तो ओशियन मॉडल दिया किसने है? ये भी याद होना चाहिए कि ओशियन मॉडल दिया किसने? ओशियन मॉडल वाज गिवन बाय पॉल कोस्टा एंड मैक्रे. ओके, ओशियन मॉडल इज गिवन बाय पॉल कोस्टा एंड मैक्रे. तो इन्वेंटिव है अगर बंदा, क्यूरियस है, ठीक है, ही अप्रिशिएट्स एंड एवरीथिंग. ओके सानिया, आई विल डू समथिंग, डोंट वरी. You are going to, it's divided into 4 parts. I'll do something, don't worry. Okay, yes. Which of the following best describes the diathesis stress model in the context of psychological disorders? I'm so sorry I spoke biological, it's psychological. ठीक है? So a model that attributes psychological disorders solely to genetic predisposition, a model that suggests disorders are caused by current environmental stressors alone, a model proposing that disorders develop from the interaction between a predisposition and the environmental stressors, and a model focusing on the resolution of intrapsychic conflicts as the cause of disorders. So I believe it is C. Okay, so the correct option is C. Okay, assertion. Regular practice of meditation can significantly reduce the physiological and psychological symptoms of stress. हाँ, assertion सही है. Okay, Shrishti, there will be 200 questions. Don't worry. Okay, 200 questions in this session plus 2:15 बजे एक session है, उसके अलग से 50 questions. Okay, you will have a bank of 250 good questions, जिसमें से आपको तो 50 questions आने हैं, 40 आपको करने हैं. Don't worry. Okay, you'll be fine. Yeah, so the only thing is कि 2:15 बजे वाला session भी do not miss. You be in this whole session and don't miss the 2:15 वाला session also. So yes, Regular practice of meditation can significantly reduce, assertion is right. Reason, meditation focuses on enhancing concentration and promoting a state of calm which can lower the blood pressure, reduce the anxiety, and improve overall well being. This is A. Okay, this is A. Now, statement one, attitudes can be formed and changed through direct personal experiences, which sometimes have a profound impact on individuals' perspective towards life and society. Okay. Cognitive dissonance theory suggests that when two cognitions or attitudes are in conflict, one will change to make them consistent, thereby reducing discomfort. The two-step concept of attitude change emphasizes the role of identification with the source before an individual can change their attitude and behavior to mimic that of the source. What about this? कौन कौन से statement सही और गलत हैं? Can anybody tell me? Yes, Sanya, don't worry. Can anybody tell me this? Yes? Attitudes can be formed and changed through direct personal experiences, which sometimes have a profound impact on an individual's perspective towards life and society. हाँ, तो मेरे हिसाब से statement one तो सही है. ठीक है? Cognitive dissonance suggests that when two cognitions and attitudes are in conflict, one can change. Two is correct, of course, but I believe, okay, you say D is correct. All are correct. Okay, तो दो स्टेप वाला जो कॉन्सेप्ट एटीट्यूड का, it emphasizes the role of identification with the source before an individual can change their attitude and behavior to mimic that of the source. Okay, see, understand that the correct is that everything is correct. Okay, now personality traits are completely stable over time and do not change in response to different life experiences. ये ध्यान से देखो, ठीक है कि क्या लिखा है यहाँ पे, personality traits are completely stable over time and it do not change in response to different life experiences. Okay, ये assertion कह रहा है आपका, right? Reason है, personality traits are developed early in life based solely on genetic factors and remain unchanged throughout an individual's lifetime. What it could be? Yes? What do you think? Okay, सबसे पहली बात गलती कहाँ हो रही है? Personality traits are completely stable and it do not change in response. No, it does change in response to different life experiences. Okay, assertion गलत है ना? अब यहाँ पे reason क्या है? Remain unchanged throughout and no, absolutely not. The option is D. Okay. Statement one, hardiness characterized by commitment, control, and challenge is a trait of stress-resistant personalities, enabling individuals to cope effectively with stress. हाँ, ठीक है. Life skills, including assertiveness and time management, cannot be learned or improved upon and are innate abilities that some individual possess. No, it can be learned. Rational thinking involves challenging distorted thinking and irrational beliefs, thereby contributing to stress reduction and improved well-being. So statement one and statement three are correct. Okay? Chalo. Assertion. Implementing comprehensive multi-sectoral strategies, including early identification and community support, significantly reduces the incidence of suicide. तो हाँ, early identification कर सकते हैं. Assertion is right. Suicides are mainly a result of individual weakness and poor decision-making skills, indicating a lack of personal resilience. No. So the assertion is true, but the reason is false. Okay. Now, after this, bipolar 1 disorder is characterized by episodes of mania and depression with possible periods of normal mood between these episodes. Okay. Suicidal behavior often reflects difficulties in problem solving and emotional expression, with suicide being influenced by a complex interplay of various factors. Haan. Statement 2 is correct. Statement 3, life skills such as assertiveness and time management can significantly improve an individual's ability to cope up with everyday's demands and challenges, enhancing stress resistance. तो बेटा 3 भी सही है, ठीक है. Bipolar 1 is characterized by episodes of mania and depression with possible periods of normal mood between these episodes. Now, अंडरस्टैंड वन थिंग कि नॉर्मल जब इंसान बाइपोलर होता है तो नॉर्मल थोड़ा सा नॉर्मल सी कम हो जाती है उसकी, ठीक है, थोड़ी सी कम हो जाती है, बट देन इसमें द स्टेटमेंट्स आर ट्रू, ओके, द स्टेटमेंट्स आर ऑल ट्रू. Now, okay, so we have to match the following. Okay, so let us all match the following. Dissociative amnesia, dissociative identity disorder, depersonalization, and major depressive disorder. Okay, so let us see dissociative amnesia कैसा हो सकता है. Dissociative amnesia is inability to recall important factors. So यहाँ पे मैं C लिख दूंगी, ठीक है. उसके बाद डिसोसिएटिव आइडेंटिटी मतलब ओके, हैविंग एटलीस्ट टू डिस्टिंक्ट एंड रिलेटिवली एंड्योरिंग पर्सनालिटी स्टेट्स. तो यहाँ पे मैं डी लिख दूंगी, ओके, यहाँ पे मैंने डी लिख दिया. डीपर्सनलाइजेशन इज फीलिंग डिस्कनेक्टेड एंड डिटैच फ्रॉम वंस सेल्फ, तो मैं यहाँ पे बी लिख दूंगी. और मेजर डिप्रेसिव इज ए, तो सी डी बी एंड ए. I believe this is right. C, D, B and A. ठीक है? That was C, D, B and A. Just a minute. हाँ. C, D, B and A. Am I right? Yes. चलो. So, MMPI, EPQ, 16 PM and social desirability. MMPI may we all know that यहाँ पे it assesses the varieties of psychopathology. So yeah, EPQ is B only. This is absolutely this, and social desirability is this. So यहाँ पे कहाँ पे आ रहा है? A, B, C and D. A. Okay, chalo. Let us read it. Trauma and stressor related disorders, including PTSD, arise in individuals who have experienced significant stress or trauma, such as natural disasters, terrorist attack, serious accidents, or warfare. Symptoms of PTSD are diverse, encompassing recurrent nightmares, flashbacks of the traumatic event, difficulty concentrating, and a sense of emotional numbness. Similarly, adjustment disorders and acute stress disorders fall under this category, characterized by difficulty in coping with stress, leading to significant impairment in social, occupational, and other important areas of functioning. Somatic symptom and related disorders represent a group of conditions wherein individuals experience physical symptoms without a corresponding physical illness. These disorders highlight the intricate relationship between the mind and the body, where psychological distress manifests through physical complaints. Somatic symptom disorder is characterized by persistent concern over physical symptoms, causing significant anxiety and disruption in daily life. Individuals with this disorder often engage in excessive health related behaviors or exhibit a disproportionate level of stress about their health concerns. Illness anxiety disorder, previously known as hypochondriasis, involves an overwhelming fear of having a serious illness despite medical reassurance. To the contrary, individuals with this disorder are preoccupied with the idea that they are sick or becoming sick or might become sick, and often misinterpret normal bodily functions as signs of serious illness. Conversion disorder presents with symptoms affecting motor or sensory functions such as paralysis or blindness that are inconsistent with medical or neurological conditions, often emerging suddenly after stressful events. These disorders underscore the complex interplay between psychological factors and physical health, emphasizing the need for a holistic approach to diagnosis and treatment. What is the common symptom of individuals experiencing significant stress or trauma? What's the common symptom? कौन बता सकता है ये? Increased concentration, recurrent nightmares, decreased emotional response, improved social interactions. That is recurrent nightmares. Which disorder is characterized by persistent concern over physical symptoms without a corresponding physical illness. Somatic symptom. अभी थोड़ी देर पहले ही मैंने मेरी क्लास में एक बच्चे को एक्सप्लेन किया था ये. How does illness anxiety disorder primarily differ from conversion disorder? Okay. So illness anxiety disorder, सबसे पहले तो ये देखना है. Illness anxiety involves a fear of being sick, whereas conversion disorder involves physical symptoms without medical explanation. Illness anxiety disorder results in physical paralysis, whereas conversion disorder leads to excessive health related behaviors. Both disorders are present with severe physical symptoms. No, both disorders are characterized by lack of psychological symptoms. तो बेटा देखो, इसमें एक प्रॉब्लम है इस पर्टिकुलर सेट में. यहाँ पे ये होना चाहिए था कि इलनेस एंजाइटी डिसऑर्डर डेफिनेटली यहाँ तक सही है, फियर ऑफ बीइंग सिक, वेर एज कन्वर्शन डिसऑर्डर, मैं इसमें ऑप्शन है इसीलिए मार्क कर दूंगी. यहाँ पे अगर ये लिखते तो ज्यादा बेटर होता है. कन्वर्जन डिसऑर्डर इन्वॉल्व्स लॉस ऑफ अ बॉडी पार्ट और समथिंग, ठीक है, something like this, but still hence I'll mark A in this. Okay, what is a common trigger for symptoms in conversion disorder? Physical illness, genetic predisposition, excessive exercise, stressful events. In a scenario where a person frequently visits doctors due to fear of serious illness despite normal test results, which disorder might be demonstrated? देखो, frequently visits the doctor क्योंकि उसको fear है, ठीक है, उसको डर है एक सीरियस इलनेस का. तो भाई अगर उसको देखो डॉक्टर को विजिट कर रहा है वो क्योंकि उसको फियर ऑफ सीरियस इलनेस है, ठीक है, पर उसको कोई सिम्टम नहीं. अगर यहाँ पे सिम्टम होता तो मैं सोमैटिक सिम्टम लिखती, बट यहाँ पे सिर्फ फियर ऑफ सीरियस इलनेस है, सिर्फ डर है उसको, एज अ रिजल्ट उसको बहुत एंजाइटी हो रही है, तो इसलिए मैं इलनेस एंजाइटी डिसऑर्डर बोलूंगी. ओके, नाउ लेट अस मैच इट अगेन. ओके, ADHD. So ADHD is yes, A. Autism spectrum, B. Intellectual difficulty or disability, C. And SLD is D. So very simple. It is A, B, C and D. Option number D. Okay, minimizing opportunities for learning prejudices can be achieved through encouraging intergroup conflicts, nahi, promoting diversity and inclusion programs, reinforcing stereotypes, nahi, limiting education and information dissemination. तो prejudice हम कब नहीं learn करेंगे? Prejudice हम तब नहीं होंगे जब we'll promote diversity and inclusion programs. Increasing intergroup contact is effective when groups meet in a competitive context. There is a lack of trust between the groups. यहाँ पे intergroup contact की बात हो रही है increase करने की. Okay, close interactions allow for better understanding. Groups have equal power and status. तो when will you increase the intergroup contact? जब groups basically क्यों मिलेंगे? Close interactions में मिलेंगे. ओके, एंड बेटर अंडरस्टैंडिंग के लिए मिलेंगे आप तो. ओके, जस्ट अ मिनट, व्हाट इज द प्रॉब्लम ओवर हियर? वेट, या व्हाट अबाउट द 31st? या, highlighting individual identity over group identity weakens the importance of what? इंडिविजुअल आइडेंटिटी जब ग्रुप आइडेंटिटी के ऊपर हम हाईलाइट कर देते हैं तो वो ग्रुप की हार्मनी को ब्रेक कर देती है. ओके, कॉग्निटिव थेरेपीज इंक्लूडिंग RET by Albert Ellis and the approach developed by Aaron Beck focuses on identifying and altering irrational thoughts and beliefs that lead to psychological distress. RET employs the ABC analysis to pinpoint the irrational beliefs and often characterized by rigid musts and shoulds, leading to negative emotions and behaviors. These beliefs lacking empirical support to negative emotions and behaviors, okay, are gently challenged through non-directive questioning by the therapist, facilitating a shift towards a rational belief system and reducing distress. Similarly, Beck's cognitive therapy traces psychological distress such as anxiety or depression to core schemas formed from childhood experiences. These schemas, when activated by specific incidents, generate negative automatic thoughts with cognitive distortions, leading to erroneous perceptions of social reality. Through gentle questioning, the therapist helps the client recognize and alter these dysfunctional cognitive structures, aiming for cognitive restructuring to alleviate anxiety and depression. CBT combining cognitive and behavioral techniques addresses psychological disorders through a biopsychosocial approach. It considers biological, psychological, and social factors contributing to a client's distress. Techniques include relaxation procedures, behavior therapy, cognitive restructuring, and environmental manipulations, making CBT a comprehensive, effective, and a versatile treatment modality for a wide range of psychological issues. What does the B stand in the ABC model used in rational emotive therapy? Let us go back. तो क्या है ये B? एंटेसिडेंट, बिलीफ एंड कॉन्सिक्वेंस यहाँ पे बहुत क्लियरली लिखा है एंड आपको ऐसे ही पैसेजेस आएंगे. रिमेंबर दैट. ओके, यू विल गेट पैसेजेस लाइक दिस. So this is right. How does Beck's cognitive therapy primarily differ from RET? ओके, तो बेक की कॉग्निटिव थेरेपी क्यों डिफर करती है? सबसे पहले तो हम यहाँ पे ये देख लेते हैं. एक सेकेंड, जैसे यहाँ पे लिखा है कंबाइनिंग कॉग्निटिव, या ओके. How does Aaron Beck's cognitive therapy differs from the rational emotive therapy? Who can tell me? What's the issue with the screen, beta? I don't know. It is out of range. Okay. Is it fine now? Can you all see this? Just give me, okay. You're not able to see the screen? Okay, wait. ठीक है, give me a minute. Just give me a minute, okay? Just give me a minute. Just give me a minute, don't worry. अभी भी आ रहा है. ओके, ठीक है. हाँ, ओके बेटा, आई थिंक अब हट गया होगा, अब नहीं है, राइट? कैन यू सी इट नाउ? It's fine. ठीक है. Let us go on to, yeah. Which of the following is a technique commonly used in cognitive behavior therapy? So yes, in cognitive behavior therapy, we use the relaxation procedures. Okay. Cognitive behavior therapy is considered effective for treating only anxiety, only depression, both anxiety and depression, both the anxiety and the depression. Okay. According to Aaron Beck's cognitive therapy, psychological distress primarily arise due to what? Negative automatic thoughts, unresolved childhood conflicts, biological predisposition, या social isolation. So yes. Okay. Question number 38. What does the term self-actualization refer in the context of humanistic existential therapies? The process of adapting to societal norms, the innate drive towards personal growth and fulfillment, the development of psychopathological symptoms, or the ability to perform in academic professional settings. It is B. Okay? Which therapy creates a non-judgmental and accepting atmosphere to help client freely express emotions and achieve the integration part? तो कौन सी ऐसी थेरेपी है? देखो, सारी ही थेरेपीज में नॉन जजमेंटल अप्रोच होता है ना? सारी ही. जस्ट अ मिनट. You say 38 is C? Self actualization is C. No. Self actualization is always B beta. Innate drive होती है जो. Yeah. Come on to this. Which therapy creates a non-judgmental and accepting atmosphere to help clients freely express? Okay, wherein they can freely express their emotions and achieve the integration. क्या ये CBT है? क्या ये humanistic existential है? क्या ये RET है? This is humanistic existential. Okay. Which of the following is not a direct consequence of heroin overdose? Slowed respiratory function, enhanced sensory perception. Sensory perception आपके enhance तो हो ही नहीं सकते. Okay. Which effect of cocaine use? Okay. Which effect of cocaine use on psychological functioning is considered unique compared to the impacts of alcohol and heroin? Induction of depressive states during withdrawal. This is the effect of cocaine. Okay, short-term memory and attention impairment, tolerance and development, dependence development, social and occupational functioning deterioration. तो यहाँ पे क्या है? Effect of cocaine use on psychological functioning. इसमें short term memory हो जाती है और आपका attention impairment हो जाता है. ओके देखो सोशल एंड ऑक्यूपेशनल फंक्शनिंग डिटीरियोरेशन तो सब में होगा बेटा, ये तो अल्कोहल में भी होगा. ओके अटेंशन इम्पेयरमेंट एंड शॉर्ट टर्म मेमोरी, yes it happens in cocaine. Generally everything, whatever substance you use, all of these happens in everything. Okay, now in client centered therapy the therapist's role is primarily to do what? Okay, provide unconditional positive regard and empathy, interpret the client's unconscious motives, direct the client towards specific behavioral change, or challenge the client's irrational beliefs. Client centered therapy की बात हो रही है, unconditional positive regard and empathy. Okay, maintaining confidentiality in psychotherapy ensures the therapist can disclose information. No, confidentiality is wherein the client feels safe to express their thoughts and feelings without the fear of exposure. Option number B. The main goal of logotherapy is to resolve the unconscious conflicts from childhood, help clients find meaning and responsibility in their life, eliminate or reduce the symptoms of mental disorders, change the maladaptive behavior patterns through reinforcement, meaning and responsibility in their life. Which of the following is a benefit of practicing yoga as an alternative therapy? Immediate cure for chronic diseases, enhancement of well-being, mood and stress tolerance. Okay, replacement for conventional medical treatments, development of supernatural abilities. No, it is enhancement of well-being. What is the primary aim of rehabilitation for patients with severe mental disorders? To ensure patients are permanently cured of their disorders. Rehabilitation to enable patients to become self-sufficient and productive members of the society, and that is what rehabilitation means. Okay, existential therapy, psychological distress is primarily due to behavioral reinforcement. No, unconscious conflicts between desires and societal norms, and inability to find meaning and confront existential anxieties. Cognitive inability to find meaning in their lives. Simple inability to find meaning in their lives. What contributes to the cycle of addiction and increased alcohol consumption? Improved social behaviors? No. Decreased tolerance requiring lesser amounts to feel the effects? Absolutely not. Withdrawal responses encouraging continued drinking? Enhanced physical stress? तो withdrawal experience करते हैं इसीलिए बार बार वो cycle की तरफ जाते हैं. Okay. How does client-centered therapy primarily differ from Gestalt therapy? Client-centered therapy focuses on the client's current feelings and thoughts, while Gestalt emphasizes the holistic self and awareness in the present moment. Okay, and yes, this is the correct answer. Okay, Gestalt is the whole. Okay, so absolutely right. The last one in this is primary psychosocial consequence of substance abuse. Immediate improvement? No. Temporary enhancement? Not at all. Long-term career advancement? Not at all. Deterioration of social relationships? Absolutely right. Okay. So this is the first 50. Now the next 50 comes up for you. Let me have the part. Okay, chalo. Yeah. So, okay. Chalo. Name the psychologist who proposed the PASS model of intelligence. Who proposed the PASS model of intelligence? J.P. Das. Okay, just a minute. Huh. J.P. Das, Jack Naglieri, and Kirby. Okay. Dash is an individual's preference for engaging in one or more specific activities relative to others. तो preference की बात जहां पे भी हो रही है वहां पे interest आएगा. ठीक है? Okay. Now, J.P. Guilford, Robert Sternberg, Howard Gardner, Arthur Jensen, Kirby. J.P. Guilford ने क्या दिया था? कौन बता सकता है? जल्दी बताओ. What did J.P. Guilford give? चलो, रॉबर्ट स्टर्नबर्ग तो आप सबको पता है. रॉबर्ट स्टर्नबर्ग ने ट्रायर्किक थ्योरी दिया था. ओके. हावर्ड गार्डनर हम सबको पता है. ही गेव द मल्टीपल इंटेलिजेंसेस. जेपी दास, नाग्लियरी एंड कर्बी गेव द पास मॉडल. नाउ हु गेव द स्ट्रक्चर ऑफ इंटेलेक्ट मॉडल? यस, जेपी गिलफर्ड गेव व्हाट? बेटा, जेपी गिलफर्ड ने क्या दिया था? Did J.P. Guilford gave the hierarchical model of intelligence or the structure of intellect model? Yes, structure of intellect model या hierarchical model? Very good, very good. Absolutely right. So this is the correct, this thing. Okay, absolutely. Structure of intellect model में कितने what should I say? Structure of intellect model में कितने cells हैं? 180. Okay. Learning to delay or defer the gratification of needs is called dash, and it plays a major role in the fulfillment of what? So learning to delay or defer the gratification of needs is known as self control. Okay, and dash, it plays like fulfillment of long term goals. Okay, so self control का example क्या है? Self control का example is roza, vrat, when you fast and all. Okay, now the dash are fat, soft and round, and by temperament they are very relaxed and very very sociable. So जो endomorphs होते हैं, ठीक है, these are fat, raw, soft and round. Dash are highly generalized dispositions. They indicate the goal around which a person's entire life seems to revolve. So these are known as the cardinal traits. Okay, जैसे आपकी बुक में एग्जाम्पल दिया हुआ है मदर टेरेसा का, ओके, गांधी जी का एंड ऑल सच थिंग्स. ओके, तो यस, the dash and dash have examined all possible personality traits. The findings indicate a set of 5 factors. They are often called as the big 5 factors. Paul Costa and Robert McRae. Okay, Paul Costa and Robert McRae. तो इनने क्या दिया है? इन्होंने ओशियन मॉडल दिया है. Right? O for openness to experience. I'll just write it very fast. C for conscientiousness. हो सकता है C for conscientiousness में मेरी spelling गलत हो जाए. Don't blame me. Yeah, extraversion, E for extraversion, A for agreeableness, and N for neuroticism. Okay, Paul Costa and Robert McRae. Dash may occur between 2 or more incompatible needs or motives, whether to study or to dance. Like whether to study dance or psychology. क्या करना है? Okay, तो ये क्या है? What is this? Is it a conflict or is it an internal pressure? You are now. Let us see it again. The match the following. Hans Selye ने क्या दिया था? Hans Selye gave the GAS model. Holmes and Rahe gave the presumptive stress event life event scale. Lazarus and Endler and Parker. अब बताओ इन दोनों में से किसने क्या दिया था? What did Lazarus give? सबसे ज्यादा कंफ्यूजन यही होता है, पता है सबको. कि लजारिस ने क्या दिया था और एंडलर और पार्कर ने क्या दिया था, बताओ। व्हाट वाज गिवन बाय लजारिस? प्राइमरी अप्रेजल। ठीक है, मैंने दो का तो कर दिया आपके लिए, अब आप मुझे दो का करके बताओ, लजारिस और एंडलर और पार्कर का। यस। Hans Selye, GS, Holmes and Rahe, presumptive stressful life events. Now, what did Lazarus give? Very good, very good. He gave the primary appraisal and they gave the coping. Good. Dash focuses on the links between mind, brain, and immune system, psycho, neuro, immunology. The Dash period was marked by increased humanism and curiosity about behavior. Which period was marked by the curiosity about the behavior? Yes. कौन सा था वो ऐसा period? Was it the Middle Ages or was it the Renaissance? These were the Middle Ages. Curiosity बढ़ी थी लोगों में, but don't you think it is Middle Ages or just a minute, just a minute. बेटा रेनेसॉन्स के साथ तो बहुत सारी चीजें आई थी, इंक्रीज क्यूरियोसिटी किस में आई थी अबाउट द बिहेवियर? Yes? Okay. Let us, we'll leave, not leave, but we'll put it as it is. By the time, please look into your NCRT and tell me. Okay? Chalo. When an electrical impulse reaches a neuron's ending, the nerve ending is stimulated to release a chemical, and that chemical is known as the neurotransmitter. ठीक है? बेटा रेनेसॉन्स वाले चैप्टर का दैट्स द फोर्थ चैप्टर. Okay? Okay, Anna, fine. Is it Renaissance? Okay. Now, yeah, Dash is characterized by extensive but selective memory loss that has no cause, no organic cause, dissociative amnesia, selective memory loss. Okay? Dash is the procedure wherein the client learns to behave in a certain way by observing the behavior of a role model or the therapist who initially acts as the role model. That is modeling. Okay? ओके सौरभ, ओके ठीक है, अब मैंने वही मार्क करा है जो आपने बोला है. The dash of an attitude indicates how positive or negative an attitude is. Taking the nuclear research example given in your book, the rating of 1 is as extreme as the rating of 5. What is this? Yes? What is this? The dash of an attitude indicates how positive or negative is an attitude. Yes? ऐसा क्या है? What of an attitude? Extremeness, valence, multiplexity. क्या है ये? Very good. Sometimes people may continue to hold stereotypes because they think that after all there must be some truth in dash what everyone says about the other group, and that is the kernel of truth concept. ठीक है? इसको kernel of truth concept बोलते हैं. The autokinetic effect was conducted by, yes, the autokinetic effect was conducted by whom? Who conducted the autokinetic effect? Can anybody tell me? Sheriff. Absolutely right. Sheriff. In this technique, the last date is announced until which the particular product or an offer will be available. The aim is to make people hurry and make the purchase before they miss the rare opportunity. What is this? कौन सा वाला सौरभ, आप कौन से की बात कर रहे हो? ओके, दिस इसका आंसर इज डेडलाइन टेक्निक। आप कौन से वाले क्वेश्चन की बात कर रहे हो? चैप्टर चैप्टर की, लाइक कौन सा चैप्टर की बात कर रहे हो आप? आप मुझे क्वेश्चन नंबर, ये क्या आप इस क्वेश्चन की बात कर रहे हो? सॉरी, कर्नल ऑफ ट्रूथ, दिस इज चैप्टर नंबर 6, एटीट्यूड, एटीट्यूड। ओके, ये आपका डेडलाइन टेक्निक हो गया। द बिल्ट इन एनवायरनमेंट यूजुअली इन्वॉल्व्स द कॉन्सेप्ट ऑफ व्हाट? द बिल्ट इन एनवायरनमेंट, बिल्ट इन एनवायरनमेंट जो है, इसका कॉन्सेप्ट, और इसका कॉन्सेप्ट क्या है बिल्ट इन एनवायरनमेंट का? कैन एनीबडी टेल मी? इज इट ऑन द स्पिरिचुअलिस्टिक कॉन्सेप्ट या मिनिमलिस्टिक या एनवायरमेंटल कॉन्सेप्ट? यस, बताइए। द बिल्ट इन एनवायरनमेंट इज बेसिकली, यू नो, ऑन व्हाट कॉन्सेप्ट या विच डिजाइन? Very good. It is the environmental design. Okay. Now, the knowledge of dash, standards and guidelines, knowledge of statuses, rules, regulations, and case laws relevant to the practice of psychology, the knowledge of the ethical codes and standards and everything. Stressed individuals may be more likely to expose themselves to pathogens, which are the disease causing agents. Okay? Yeah. यस सृष्टि, थोड़ा सा लैग है, 10-12 सेकेंड्स का लैग होता है यहाँ पे और यूट्यूब में। ओके, हाँ। In dash, the therapist points out the client and dash aspect of their psyche that must be faced by the client. So it is confrontation. Okay, the name itself suggests confront karna, confrontation. In dash, the therapist points out to the client an aspect of dash side, their psyche that must be faced. Yes, is the confrontation the same question? In the process of RET, the irrational beliefs are refuted by the therapist to the, through a process of non-directive questioning. In the client is taught to contract the individual muscle groups in order to give the awareness of tenseness or muscular tension, that is progressive muscular relaxation. A full-blown dash is helpful in making the therapist aware of the nature of intra-psychic conflict suffered by the client. So full-blown transference neurosis. Okay, a full-blown transference neurosis. If the perceiver pays attention to the information given till the last, then the last information given has a lasting effect, and that is called as what? बताओ। ये रीसेंसी प्राइमेसी वाला है, आपको समझ में आ रहा है? यहाँ पे ये लिखा हुआ है कि इंफॉर्मेशन, सिंपल देखो, pays attention to the information given till the last. अगर आप लास्ट इंफॉर्मेशन पे अटेंशन पे करते हो, तो जो लास्ट इंफॉर्मेशन होती है, ओके, उसका लास्टिंग इफेक्ट होता है, या लास्ट मैसेज का लास्टिंग इफेक्ट होता है। ओके, एंड उस इफेक्ट को क्या बोलते हैं? इज इट द रीसेंसी इफेक्ट और इट इज द प्राइमेसी इफेक्ट? It is the recency effect. We know if an individual is tidy and punctual, we are likely to think that the person will be hardworking too, और इस phenomenon को हम बोलते हैं the halo effect. Okay? Now, an accident on roadside, whether there are a lot of people gathered, each one will think it is not its responsibility to help the victim, and someday someone else will help it. So that's the diffusion of responsibility. When we meet people in public, we start making conclusions about their personal qualities, and this is called as impression formation. Okay? You were interviewed by your school selection team for the post of the head boy or the head girl. Explain the interpersonal distance in this situation. तो जब इंटरव्यू कर रहा है कोई आपको, when you are being interviewed, that's the social distance. ओके, पब्लिक डिस्टेंस इसलिए नहीं होगा कि पब्लिक डिस्टेंस पे स्टेज पे कोई स्पीकर बोल रहा होता है टू द ऑडियंस। ओके, दिस इज व्हाई इसको हम सोशल डिस्टेंस बोलेंगे। Identify the first step as a treatment towards psychological disorders, providing material relief, counseling, psychiatric help, या rehabilitation. ये क्वेश्चन अगर थोड़ा सा ऐसा होता ना, साइकोलॉजिकल हेल्प डिसऑर्डर्स टू द विक्टिम्स ऑफ फ्लड, अगर ऐसा क्वेश्चन होता ना तो फर्स्ट स्टेप ऑफ ट्रीटमेंट तब जाता प्रोवाइडिंग मटेरियल रिलीफ. Okay, generally the question, if the question will come, the question will come to you like that only. Okay, it will not come to you in this way. और अगर आया कि ट्रीटमेंट टुवर्ड साइकोलॉजिकल डिसऑर्डर्स, ओके, तो फिर वो ऑप्शंस में रैपो क्रिएशन भी आएगा. Okay, but the question is supposed to be like this. Okay, understand yes, the question is supposed to be like this, and hence providing material relief. Dash it refers to a feeling of discomfort because there are too many people or things around us giving us the experience of physical restriction and sometimes a lack of privacy. That's crowding. The traditional Indian view about the environment supports what perspective? It supports the spiritual perspective. Okay. Dash refers to the ability to mentally deal with the high density of crowded environment, such as crowded residence. Mentally dealing with the high density of crowded environment, such as crowded residence, crowding tolerance. Okay? When an observer is actively involved in the process of observing by becoming an active member of the setting where the observation takes place, that is the participant observation. Okay, जब आप भी उसी टाइप के आप उसी टाइप के ऑब्जर्वेशन में हो तब. Dash are the emotional control and balance, tolerance, understanding of interpersonal conflict, tolerance of ambiguity and uncertainty, control and balance, affective skills. Okay, क्योंकि इमोशनली वो चीज हो रही है, इसीलिए. When someone is listening to you and told to restate what you said, at that time the person is not able to repeat your exact words. They make a summary of the ideas just received and provides you with a restatement of what he or she understands, and this is called as paraphrasing. Okay? Dash means that the behavioral expressions are consistent with what you value and the way you feel and relate to your inner self-image, and that is authenticity. Stress differs from individual to individual in terms of intensity, duration, complexity, and predictability. Assertion is right, but the reason is wrong because यहाँ लिखा है 23-year-old has more stress than 11-year-old. The reason is wrong. When a child does exactly the opposite of what is being told to him, which disorder is this? This is oppositional defiant disorder or ODD. Who insisted that witches were mentally disturbed and required medical not theological treatment? देखो लेव वाइगॉट्स्की तो बोल नहीं सकते ये, है ना. सेंट ऑगस्टीन एंड जोहान वियर में से किसने ये चीज बोली थी कि विचेस वर मेंटली इल और वो एक मेडिकल ट्रीटमेंट रिक्वायर्ड होता है उनको? यस. हु सेड दिस? सेंट ऑगस्टीन या जोहान वियर? लेव वाइगॉट्स्की नेवर सेड इट बिकॉज लेव वाइगॉट्स्की ने कल्चर डेवलप किया था. ओके, कल्चर. सो व्हाट अबाउट दिस? यस, इट वाज बीइंग सेड बाय जोहान वियर. Myra keeps getting episodes wherein at once she's elated and she keeps yelling and laughing, and on the other extreme within seconds she sits alone with a feeling of hopelessness. So this is bipolar disorder. Dash involves persistent preoccupation about developing a serious illness and constantly worrying about its possibility. This is accompanied by anxieties about one's health. It is illness anxiety. Mr. Collins is a 61-year-old man who's having a poverty of speech, and also he doesn't show any emotion at all. To the extent he doesn't even show any of his feelings to anybody, and also he maintains bizarre position for about 72 hours. So just a minute. Okay, poverty of speech है, he doesn't show any emotion at all. तो feelings भी नहीं बताते, bizarre positions. So he is basically suffering from schizophrenia. Let's see. आगे पता, I don't know question. Schizophrenia, and he has the negative and psychomotor symptoms of schizophrenia. Okay, he has the negative and psychomotor symptoms of schizophrenia. When we meet similar people, they reinforce and validate our opinions and values. We feel we are right and thus we start liking them. This is similarity. Okay, individuals work less hard in a group than they do when performing alone, और इसको बोलते हैं social loafing. Intergroup conflicts can be resolved by bringing about a change in the perception of parties towards one another through persuasion, media appeals, and when you alter people's perceptions. When your school wins an inter-institutional debate, you feel proud and think that you're better than others. And this is an example of status. Okay? Dash is a situation of extreme cohesiveness. Extreme cohesiveness की situation क्या होती है बताओ? What is the situation of extreme cohesiveness? Can anybody tell me? What's the situation of extreme cohesiveness? Anybody? Is it group polarization or group think or what? Yes? Group think or group polarization? Yes. Of course, C तो है ही नहीं बेटा ऑप्शन में. C है ही नहीं. This is group think. Okay. They are pre-existing formation that are usually given to the individuals. So given pre-existing, this is primary group. Okay. Now we move on to the part 3. Okay. Let's move on to this and then we'll, yeah. Chalo. Okay. Let's go. So the central thesis of this therapy is that irrational beliefs mediate between the antecedent events and their consequences. Which therapy is this? RET. The irrational beliefs mediate between the antecedent events and their consequences. Okay? The goal of DASH is to increase an individual's self-awareness and self-acceptance. Self-awareness and self-acceptance. What do you mean by that? किसमें कौन सी थेरेपी में सेल्फ अवेयरनेस और सेल्फ एक्सेप्टेंस इंक्रीज करी जाती है? कैन एनीबडी टेल मी दैट? Yes. The goal of DASH is to increase an individual's, yes, Gestalt या कौन सी थेरेपी है ये? Is it Gestalt? Is it client centered? Is it logotherapy? What do you all say? Self awareness बेटा, self awareness की बात हो रही है. Yes, whole, you know, एक whole perspective से बात हो रही होती है ना जब. देखो, logotherapy is the treatment for the soul. Okay, logotherapy is what? Treatment for the soul. It is client centered. Okay, the rapid breathing techniques to induce hyperventilation is a part of Sudarshana Kriya. Okay, the client centered therapy was given by Carl Rogers. Schemas that function in the form of category. Okay, schemas that function in the form of categories are known as prototypes. The information presented first has a stronger effect than the information presented at the end. So this is what? The first effect, the primacy effect. Okay, हमने अभी recency वाला किया था I think. Dash refers to all those psychological processes that deal with the gathering and processing of information related to social object, and it is social cognition. The dash of an attitude tells us whether an attitude is positive or negative towards an attitude object. So, valence. Or what? Yes? Learning attitudes through modeling is mostly seen when we see attitudes through the norms of our group or culture. We observe others being rewarded or punished for expressing thoughts. An individual is praised for showing a particular attitude. Yeah, all of the above. What could be the example of this? Sorry, what could be the correct option for this? Yes? इसका correct option क्या हो सकता है? Can anybody tell me? Learning attitudes through modeling is seen when modeling. कि जब आप, when we see groups and norms of our own culture or group, we observe others being rewarded or punished, and an individual is praised for showing the attitude. This is all of the above, okay? The POX triangle, which represents the relationship between person, another person, and attitude object, was proposed by Fritz Heider. And dash is a collection of people who have assembled for a special purpose, audience. Dash is a stage of intra-group conflict. It is storming. Okay. Dash refers to togetherness, binding, or mutual attraction among the group members, cohesiveness. Self-concept is the way we perceive ourselves and the ideas we hold about our competencies and attributes. Parents who make decisions for their children when they do not need assistance often suffer from low self-esteem. So what about this assertion reason? Yes? What about this assertion reason? Are both true or both false or what? ये assertion reason क्या है? Self-concept is the way we perceive ourselves and the ideas that we hold about our competencies and attributes. बिल्कुल सही है, ठीक है? Parents who make decisions. Okay, now you understand that both of them are correct, but nothing is explaining A. It is B. Okay. Sorry, not B, not B. Wait. Parents who make decisions for their children when they do not need assistance often suffer from low self-esteem. हाँ, reason सही है, but R is not the correct explanation of A. Which factor is true of people who are low in self-efficacy? Understand now. Do this now. Okay. So yeah, they feel less fearful and do not shy away from taking risk. Low in self-efficacy. ठीक है? कौन सा true है? They avoid challenges and allow people to select and shape their environment. They don't believe that luck and fate can control their outcomes, can be enhanced by presenting weak role models. Even if you feel that, एक ऑप्शन सही है इसमें से आप एक कर सकते हो, आई डोंट हैव अ प्रॉब्लम. यू कैन टेल मी व्हाट डू यू थिंक कि इसमें से कौन सा स्टेटमेंट सही है अबाउट पीपल हु आर लो इन सेल्फ एफिकेसी? यस, लो इन सेल्फ एफिकेसी. यस, बी तो एक है ही इसमें, लाइक सॉरी, बी मतलब सेकंड इज राइट. ओके, सेकंड बिल्कुल ट्रू है अबाउट पीपल अबाउट सेल्फ एफिकेसीज. हाँ, तो इस पर्टिकुलर केस में हम अगर ये ऑप्शन ना भी दे तो भी चलेगा, बट स्टिल सेकंड एंड फोर्थ वील मार्क इट एज डी. ओके. Okay, this is very easy. In which year Charles Spearman proposed the two-factor theory? यहाँ पे लिखा हुआ है in 1927. Who proposed the theory of primary mental abilities? Louis Thurston. 4 examples of S factors are given over here. Okay. Now, Tanya was a student of 12th humanities. When she went for aptitude testing, she scored highest in fluency and was under the category of word smart. Okay. Whereas she was unable to score good on the quantitative part. Her brother Tanuj is a national level hockey player and both the siblings have an innate love for the flora and fauna. So she scored highest in which type of intelligence? Word smart hai, to linguistic. Okay. Tanuj is a national level hockey player, तो वो कौन सी intelligence में high है? वो bodily kinesthetic में है. I'll just write kinesthetic. Since Tanya could not score good on quantitative part, तो वो किस में low हुई? वो लो हुई लॉजिकल मैथमेटिकल इंटेलिजेंस में. ठीक है. बोथ तान्या एंड तनुज आर हाई ऑन डैश एस्पेक्ट ऑफ इंटेलिजेंस ड्यू टू देयर लव फॉर फ्लोरा एंड फौना, नेचुरलिस्टिक. ठीक है. सो यस, नेहल, आपके एग्जाम में ऑप्शंस रहेंगे. ओके, मैंने इसलिए ऑप्शन नहीं दिए बिकॉज दिस इज वेरी इजी, राइट. Dash is known as neurotic anxiety of spiritual origin, existential anxiety. Individuals with IQs above 130 are considered to be very superior. Okay. Individuals with IQs below 25 are said to fall under the category of mild mental retardation. The assertion is true, but the reason is false. Option number C. IQs, IQs below 25 are considered to be profoundly mentally retarded. Okay. When people believe that their feelings, thoughts, and actions are controlled by others, it is the delusion of control. Okay. Yeah. When the person has to use more and more of a substance to get the same effect, it is known as what? More and more of, you know, basically, और ज्यादा substance अगर वो उसको चाहिए तो क्या होता है वो? When a person has to use more and more of a substance to get the same effect. Yes. पहले क्या होता था, देखो, पहले क्या होता था कि ही यूज्ड टू हैव वन सब्सटेंस, ठीक है, उसके एंड देन ही यूज्ड टू फील गुड. नाउ ही वांट्स टू फील द सेम लेवल ऑफ गुड. ओके, तो अब उसको और वही सब्सटेंस चाहिए. उसने टॉलरेंस तो डेवलप कर ली है. ओके, टॉलरेंस डेवलप कर लिए. नाउ ही इज डिपेंडेंट अपॉन द सब्सटेंस. दिस इज नॉट सब्सटेंस अब्यूज, बट सब्सटेंस अब्यूज का तो क्वेश्चन है ये. ओके. The strategy, which involves denying or minimizing the seriousness of a situation while coping with stress, is known as avoidance-oriented strategy. The leukocyte that is attacked by HIV virus is known as what? Is it the T cell, or is it the killer cell, or is it the B cell, or is it the T helper cell? Which leukocyte, okay, or which WBC, like WBCs are leukocytes only. So which white blood cell or which leukocyte is basically attacked by the HIV virus? Yes. Which is attacked by HIV? Is it the killer cell, or is it the T cell, or is it the B cell, or is it the T helper cell? कोई भी, not only HIV, but कौन से, जो भी कोई दूसरा जो आउट साइड वाला जो होता है वो किससे? टी हेल्पर सेल. What are all the following are healthy ways to cope up with stress except reaction formation, क्योंकि reaction formation एक टाइप का डिफेंस मैकेनिज्म है और वो एक अनहेल्दी वे ऑफ कोपिंग है. Okay, dash is likely to occur in socially homogeneous cohesive groups that are isolated from outsiders. So isolated from outsiders, socially homogeneous cohesive groups की बात हो रही है तो group think है. Okay, which of the following statements are true about self as an object? Okay, self is an entity that does something. Self is being described as a knower. Self gets observed and comes to be known. So third is right. Okay, self is an entity on which something is being done. Object की बात हो रही है, ठीक है? It is object, right? It's not subject, right? So okay, just a minute. Wait. Not this. Self gets observed and comes to be known. Okay. So just a minute. Self gets observed. Is it option number B or D? Just a minute. Wait. Huh. Okay. Self is being described as a knower. No. Self gets observed and comes to be known. That is option number 3. Okay. That is, of course, object. And of course, जैसे एक option है ना कि okay, I am a topper. Okay, that's subject. And I am a topper, that is a subject. And I have scored, how many marks? I have scored 100 marks. So yes, self is described as a knower, entity that does something. So 1 and 3, and 1 and 3 किस में आ रहे? A में आ रहे. When group members take time to develop norms related to group behavior, दिस इज नोन एज व्हाट? नॉर्म्स की बात हो रही है, दिस इज नॉर्मिंग. Dash is the procedure wherein the client learns to behave in a certain way by observing the behavior of a role model or the therapist who initially acts as a role model. Putting yourself in others' shoes is known as empathy. The most popular therapy which combines cognitive therapy with behavioral techniques is the cognitive behavioral therapy, or CBT. When a child is given a coupon to buy something from the school canteen for punctuality, it is a form of token economy. People with somatoform disorders mostly complain about what? Bodily symptoms without any physical disease. Somatic symptom बोल सकती थी मैं यहाँ पे. Somatic symptom. Okay? That's bodily symptom without any physical disease. Dash is characterized by extensive but selective memory loss, no organic cause, dissociative amnesia. Dash is diagnosed if a person has a persistent belief that they have a serious illness despite medical reassurance, lack of physical findings, and failure to develop the disease. I believe यहाँ पे it's not in the options, but we can write over here. या तो यहाँ पे अपन none of the above option लिख दें. Okay. Persistent belief that they have a serious illness, lack of physical findings, serious illness है उनके पास, तो यहाँ पे हम somatic symptom ऐसे option दे सकते हैं, या illness anxiety. So don't focus much on this question then. Okay. Yeah. In Dash, individual contributions and teamwork matters. So definitely in team, it matters. Karen Horney emphasized on human growth and actualization to adopt the optimistic view on human life. Okay, so the psychology in which behaviors are studied in the social situation, उसे हम बोलते हैं social psychology. Where was the first laboratory of modern psychology established? कहाँ पे establish हुई थी सबसे पहली laboratory? लीप्जिग इन जर्मनी. और अच्छा, अगर आपको क्वेश्चन आ गया कि इंडिया में कहाँ एस्टैब्लिश हुई थी, तो आप क्या लिखोगे? अगर इंडिया की बात आई तो इंडिया में सबसे पहली साइकोलॉजी की लेबोरेटरी एस्टैब्लिश हुई थी कैलकाटा में. ओके, बट ये ऑप्शन, ये क्वेश्चन के अकॉर्डिंग लीप्जिग. Dash established the first experimental laboratory in Leipzig, Germany. किसने establish करी थी? किसने करी थी? कोई बता सकता है? विल्हेल्म वुंट ने करी थी. तो विल्हेल्म वुंट ने करी थी, and he is also known as the father of psychology. इसीलिए इनको father of psychology बोला जाता है. ठीक है? In psychology, the words psyche and logos are made up of two words, which means it's the science of soul. Okay? Now, the introspective report in an experiment is given by whom? Introspective report. Introspective report दिया जाता है, subject देता है introspective report. ठीक है? Dash is defined as proficiency, facility or dexterity that is acquired or developed through training and experience, and उसको skill बोलते हैं, proficiency or dexterity or something. You're talking to your very good friend, identify the interpersonal distance in this situation. Okay? When you're talking to your Mahima, you do not need to know that, okay? वो नहीं आएगा, इंडिया वाला क्वेश्चन भी नहीं आएगा वैसे तो. आई वॉज जस्ट टेलिंग यू. सो यस, व्हेन यू टॉक टू योर फ्रेंड, यू आर टॉकिंग टू योर वेरी गुड फ्रेंड, तो कौन सा टाइप का इंटरपर्सनल डिस्टेंस आएगा उस सिचुएशन में? कोई बता सकता है? विच टाइप ऑफ इंटरपर्सनल डिस्टेंस विल कम इन दैट सिचुएशन? यस, ओके, somebody is saying intimate distance, कोई बोल रहा है पर्सनल डिस्टेंस. ओके, तो इंटीमेट डिस्टेंस कब आता है? सी, यहाँ लिखा है वेरी गुड फ्रेंड. ठीक है, यहाँ पे क्लोज फ्रेंड नहीं लिखा है. अगर क्लोज फ्रेंड लिखा होता तो हम इंटीमेट डिस्टेंस मार्क करते. ठीक है, यहाँ पे वेरी गुड फ्रेंड लिखा हुआ है, ठीक है, तो क्योंकि यहाँ पे वेरी गुड फ्रेंड लिखा हुआ है, दिस इज वाई वी आर गोइंग टू मार्क इट एज पर्सनल डिस्टेंस. An emotional state that arises when a person is prevented from reaching a goal or attaining an object what they want. तो यहाँ पे हम क्या लिखेंगे, दिस इज फ्रस्ट्रेशन. ब्लॉकिंग ऑफ नीड्स जब भी आए, याद रखना, ब्लॉकिंग ऑफ नीड्स जब भी आए, इट इज ऑलवेज फ्रस्ट्रेशन. Forceful destructive behavior towards another person or object is termed as what? देखो, forceful destructive behavior towards another object or person is known as violence. ठीक है, डिस्ट्रक्टिव है तो इसीलिए वायलेंस. ओके, the dash perspective suggests that the physical environment exists for use by human beings for their comfort and well-being. Minimalist. Dash means behaving according to the group norm. So when you behave according to the group norm, you conform to the group norm. ठीक है? Dash means that people feel obliged to return what they get. Reciprocity and giftedness from the teacher's point of view depends upon a combination of high creativity, high ability and high commitment. यहाँ पे आपके 150 questions are done. Now the last set of 50 questions. Okay? Chalo, let us start. Okay. Assertion. Psychological assessment involves measuring and evaluating psychological attributes. Just a minute. Huh. Psychological assessment involves measuring and evaluating psychological attributes of individuals, often using multiple methods. Okay. What about this? Okay, just a minute. Yeah, that was minimalist. Sorry, that was not minimalist. That was instrumental perspective. Okay. Chalo, let us focus on this first. Psychological assessment involves measuring and evaluating psychological attributes of individuals, often using multiple methods. Huh? Psychological attributes like happiness and dominance can be accurately and consistently measured using informal assessment methods. So, assertion is right, but the reason is wrong. That is option number C, we will mark. Okay, option number C. What did Alfred Binet's uni or one factor theory of intelligence emphasize in this conceptualization of intelligence? Uni factor or one factor? Okay, Alfred Binet ने दिया था. Just a minute. हाँ, a single set of diverse abilities, multiple indices of cognitive abilities, a single set of cognitive abilities, या cognitive functions underlying intelligent behavior. तो a single index of cognitive abilities. Okay? Okay. Statements हैं. Thurston's theory of primary mental ability suggests that intelligence is multifaceted, comprising 7 distinct yet relatively independent abilities. Okay. Guilford's structure of intellect model implies that intellectual traits can be exhaustively categorized into 180 distinct cells, each representing a unique combination of operation, contents, and products. What about this? So both are correct or both are incorrect or one is correct? I believe both are correct. Okay? Both are there. Both are right. Arrange the following psychological attributes based on their direct visibility in outward behavior from the most visible to the least. Now understand a question like this. ठीक है? इसके एक से ज़्यादा आंसर्स हो सकते हैं. Okay, you understand? A question like this, it can have more than, one answers. Okay, तो what about this? सबसे पहले आपकी आउटवर्ड अपीयरेंस में क्या क्या दिखता है? आपकी आउटवर्ड अपीयरेंस, तो पर्सनालिटी. ओके, पर्सनालिटी, एप्टीट्यूड, इंटरेस्ट. ओके, वेट, जस्ट अ मिनट. सबसे पहले आपकी वैल्यूज, इन ये लोग बोल रहे हैं कि वैल्यूज, ओके, पर्सनालिटी, इंटरेस्ट, एप्टीट्यूड एंड वैल्यूज. व्हाट अबाउट द करेक्ट ऑप्शन? मेरे हिसाब से मेरे हिसाब से तो ए है. ओके, मुझे ऐसा लगता है ए. ओके, लेट अस मैच. लिंग्विस्टिक में कौन अच्छे होते हैं? लिंग्विस्टिक, सो ए इज टू. लॉजिकल मैथमेटिकल इज साइंटिस्ट एंड नोबेल प्राइज विनर्स, तो यहाँ पे 3 आ जाएगा. स्पेशल इज पायलट्स एंड स्कल्प्टर्स, तो 4 आ जाएगा. एंड बॉडीली काइनेस्थेटिक 1 आ जाएगा. 2, 3, 4 एंड 1. ऑप्शन नंबर ए. Which psychological assessment method is particularly noted for its in-depth and comprehensive approach but may suffer from the subjective interpretation? Case study. Anything that is in-depth is a case study. ठीक है? Alfred Binet, one of the early intelligence theorists, defined intelligence as the ability to judge well, understand well, and reason well. A. According to Robert Sternberg's triarchic theory of intelligence, which type of intelligence is primarily involved in the ability to generate novel solutions? Okay. यहाँ पे क्या लिखा है? Primarily involved in the ability to generate in the novel solutions. तो ये कौन सी इंटेलिजेंस हुई? क्या ये कॉम्पोनेंशियल होगी, क्या ये एक्सपीरियंशियल होगी, या एक कॉन्टेक्चुअल होगी, या एनालिटिकल? लाइक कॉम्पोनेंशियल एंड एनालिटिकल आर ऑलमोस्ट सेम. So what it could be? According to Robert Sternberg, what it could be? What do you think? Ability to generate novel solutions. Novel solutions? Experiential. Okay? In the PASS model, which process is responsible for integrating the information into the knowledge system by perceiving the relation amongst various concepts and integrating them into a meaningful pattern for comprehension? Batao. In PASS model, वो इसका क्या आंसर हो सकता है गाइज? अराउजल, सक्सेसिव प्रोसेसिंग, साइमल्टेनियस प्रोसेसिंग, या अटेंशन? व्हाट इट कुड बी? Successive, simultaneous, perceiving the relations among various concepts and integrating them into a meaningful pattern. Into a meaningful pattern is simultaneous processing. Which concept refers to the characteristic and relatively stable patterns of behavior that are reflected in the diverse ways individuals react to different situations? Personality. Okay, statements. The personal self primarily focuses on attributes that relate to one's individual's achievement, freedom, and comforts. The social self is primarily concerned with one's own needs and less with family. तो ये तो गलत हो गया. The biological self is an early form of self-awareness exemplified by a newborn's cry for milk. ठीक है. The social self emerges from the child's psychological and social needs and values cooperation, unity, and family relationships. तो ये भी सही है. Okay, relate to one's individual achievements. So 1, 3 and 4. Okay. C. The dash culture, in the dash culture, the self is often not distinguished from the group, leading to a state of harmonious coexistence, while in dash culture the self and group are, so the correct is Indian and Western. Option A. Okay. The original Latin meaning of personality is derived from the word persona, which refers to the mask which is used by the actors. Assertion: by the age of 6 to 7 years, children have formed a stable self-esteem in areas such as academic and social competence. Okay. Self-concept is a general view of oneself that is overall either positive or negative and is not related to specific domains like academic or social competence. नहीं, ऐसा तो बिल्कुल नहीं है. Self concept is definitely related to academic and social competence. होता है ऐसा? So the correct is C, that is A is true and R is false. Okay. Which of the following is not a feature of personality? Not a feature. Bipartite. Okay. That is not a feature of personality. Okay. Match trait, disposition, character and habit. तो यहाँ से चालू करते हैं हम. Habit, like 1. Trait is a stable pattern of behaving. Okay. Character, disposition. Okay. So मेरे हिसाब से A4, B3, C2 and D1. So 4, 3, 2, 1 is D. In Charak Samhita, individuals are categorized into dash and dash types representing the unique blend of humoral elements based on the Tridosha system. So it's Vat, Pitta and Kapha. तो आपको इसमें कुछ नहीं करना है, आपको इसमें all of the above mark करना है. Okay? Which of the following best describes the characteristics of the mesomorphic personality as proposed by Sheldon? So ectomorphic, endomorphic, mesomorphic. Okay? तो mesomorphic क्या होते हैं? Who are the mesomorphics? So relaxed and round तो endomorphics हो गए, ठीक है? Thin, fragile, strong and courageous, fat and sociable. तो यहाँ पे mesomorphic क्या हो गए बताओ? Can anybody tell me who are mesomorphics? Relaxed and sound तो नहीं होते ना? Relaxed, round, fat, sociable तो endomorphics होते हैं. तो हाँ. What is 18th? Mesomorphics are thin and fragile. Okay. So in the appraisal of potentially negative events, harm refers to the past damage that has already been done. ठीक है? Already been done. A person's past experiences in handling stressful situations can influence their perception of the current stressors. Okay. आज जिस तरीके से उन्हें पास्ट की स्ट्रेसफुल सिचुएशंस को हैंडल किया है. Okay. So perception of current stressors. Individuals who have never encountered stress before are more likely to view new stressors as less threatening. So what it could be? What could be the correct option in this? Yes. A person's past experience in handling stressful situation can influence their perception of current stressors. हाँ, it is right. बिल्कुल सही है कि उनका past experience क्या रहा है. Okay, and whereas individuals who have never encountered stress, बिल्कुल सही, दोनों सही है, but explain नहीं कर पा रहा है. तो it is B. Which of the following is an example of social stress? Social stress, environment stress की बात नहीं हुई है, parties. Physical stress is always caused by lack of physical activity and can never result from overexertion. तो ये तो गलत है. Psychological stress is unique to each individual and can result from internal conflicts and social pressures. हाँ, right. Environmental stress is only related to natural disasters and does not include factors like pollution or extreme temperatures. Wrong. Social pressures such as source of psychological stress may come from people who impose excessive demands on us. So this is second and four. Second and four, that is option number B. Challenge appraisals in the primary appraisal process are associated with what? Challenge appraisal. What in primary appraisal process are associated with immediate threat, avoidance behavior, confident expectations या helplessness. What about this? क्या हो सकता है ये? Yes, who can tell me what it could be? Challenge appraisals in the primary appraisal process are associated with what? These are associated with Who can tell this? You say confident expectations. Are you sure? Very good. Okay, now let us match the following again. Emotional, physiological, cognitive, and behavioral. So, okay, let us see. Behavioral में क्या हो सकता है? Behavioral could be what? Yes, behavioral could be mood swings. Okay, cognitive could be is cognitive D? Yes, cognitive could be poor concentration. Physiological could be expansion of air passages, and emotional could be mood swings. So A as in B, C, D, and A. That is A is mood swings, मतलब ये physiological is C, expansion of air passages, cognitive में poor concentration and behavior में disrupted sleep patterns. Okay, but I am a little bit. Is it A? All of you say, is it A? Just a minute. Is it A or is it? Okay, anyway, yeah. Option number A. Arrange the following stress management techniques in the order they should ideally be performed according to the description in the text. So, what do you think? What should be performed सबसे पहले? सबसे पहले तो डेफिनेटली सीबीटी दैट इज कॉग्निटिव बिहेवियरल टेक्निक आएगी. ठीक है, सबसे पहले कॉग्निटिव बिहेवियरल टेक्निक आएगी. कॉग्निटिव बिहेवियरल टेक्निक क्योंकि इट्स अ थेरेपी, राइट? हेंस सीबीटी सबसे पहले लाइक कॉग्निटिव बिहेवियरल थेरेपी. कॉग्निटिव बिहेवियरल थेरेपी के बाद आएगा एक्सरसाइज. एक्सरसाइज के बाद बायो फीडबैक एंड देन द रिलैक्सेशन टेक्निक्स. सो बी. ओके, okay, question ये passage है. Although many definitions of abnormality have been used over the years, none has one universal acceptance. Still, most definitions have certain common features, often called as the 4Ds: deviance, distress, dysfunction, and danger. That is, psychological disorders are deviant, distressing, dysfunctional, of course, and dangerous, possible threats. Okay, this definition is a useful starting from which we can explore psychological abnormality, since the word abnormal literally means away from the normal. It implies deviation from some clearly defined norms or standards. In psychology, we have no ideal model or even normal mode of human behavior to use as a base for comparison. Various approaches have been used in distinguishing between normal and abnormal behaviors. From these approaches, there emerge two basic and conflicting views. uh, the first approach views abnormal behavior as a deviation from social norms. Many psychologists have stated that abnormal is simply a label that is given to a behavior which is defined from social expectations. Abnormal behavior, thoughts, and emotions are those that differ markedly from a society's idea of proper functioning. Each society has norms which are stated or unstated rules for proper conduct. Behaviors, thoughts, and emotions that break societal norms are called as abnormal. So, what ancient belief about the cause of abnormal behavior is still encountered in modern times? Exorcism. Which period was known for the beliefs that psychological disorders were caused by evil and involved numerous witch hunts? Yes, who can tell me this? कौन सा ऐसा होता था, लाइक एक कौन सा पीरियड था which was there for the belief that psychological disorders were basically caused by evil and involved numerous witch hunts? witch hunts किस में होते थे बताओ? witch hunting. yes, मिडिल एजेस, रेनेसा, मॉडर्न एरा तो ऑप्शन ही ऑप्शन में से हटा दो इसको. तो इन तीन में से क्या है, ए, बी या सी? Yes, it's the Middle Ages. What is the main purpose of classifying psychological disorders? Very easy. You know, it's the classification. ये option कुछ और अच्छे हो सकते थे इसमें से better, but based on this, it's just classification. According to the biological model, what basis does abnormal behavior have? It's the biochemical. Which model believes that abnormal behavior, whether normal or not, is determined by psychological forces within a person in which they are not consciously aware? Which model believes it जब consciously aware नहीं होते तो? What's the primary focus of attention in the therapeutic approach? The client. Empathy in the therapeutic relationship means having compassion and pity towards the suffering of the client. Assertion is wrong. Empathy involves understanding and feeling the client's situation from their own perspective rather than just having intellectual understanding. So A is false, R is true. Psychotherapy aims at dash thinking patterns to help the clients overcome their psychological issues, to changing their thinking patterns. Or altering would be a good option. Modifying would be a good option. Which of the following is a goal of psychotherapy related to personal development? Reinforcing the resolve, changing the diet, correcting the posture, or increasing the income. It is the reinforcing the resolve. Okay, we have this again. Behavior therapy attributes psychological problems primarily to intrapsychic conflicts. Okay. Intrapsychic conflicts and behavior therapy. Okay. Psychodynamic therapy uses methods like free association and dream reporting to elicit thoughts and feelings. Second is true. Existential therapies focuses on the client finding solution through a process of personal growth. Behavior therapy values emotional insight as the primary benefit to the client. Now, what is this? Is second and third right? What do you think? ये second और third जो है वो correct है? Yes. Second and the third. Do you say that second and third are correct? B. What do you say? B or C? बताइए. मेरे हिसाब से B. Okay. In behavior therapy, dash operations control the behavior by changing something that precedes the behavior. Yes, in behavior therapy, the dash options will control the behavior by changing something that precedes the behavior. Dash operations will control the behavior by changing something that precedes the behavior. What about this? Is it the antecedent? Is it the antecedent operations or the consequent operations? Yes. Very good. What is the central thesis of RET formulated by Albert Ellis? Irrational beliefs. Effective strategies include increasing opportunities for learning prejudice. No. Encouraging close interactions between group and cooperative context can be beneficial. Okay. Highlighting group identity rather than individual identity is key to reduce the prejudice. Education and information dissemination can help in correcting stereotypes and reducing the in-group bias. So, according to me, second and four. Okay, second and four. Okay. What component of prejudice is often accompanied by dislike or hatred towards a particular group? Dislike है और hatred भी है, तो which component of prejudice is basically this? Can anybody tell me? Question number 39. Which component of prejudice is often accompanied by dislike or hatred towards a particular group? Yes? Is it the stereotype? Or is it the behavioral? Or is it the affective component? Or is it the cognitive component? कौन बता सकता है ये? Yes? Who can tell me this? Affective component, क्योंकि affective वो emotional एक वो चीज होती है ना कि you know how has this happened? लाइक एक वो इमोशनल अंदर से एक चीज होती है, वो कंपोनेंट बेसिकली बोला जाता है उसको। ठीक है। Psychologists have found that attitudes are more likely to be consistent with behavior when the person believes that the behavior will have a positive consequence. Okay? Okay, the kernel of truth concept reduces the persistence of stereotypes and prejudices. No, it doesn't reduce. People tend to hold on to stereotypes because they believe there must be some accuracy in widely held beliefs, even if only supported by a few examples. So, assertion is false, but the reason is true. Okay? Which condition is necessary for a person's attitude to be consistently exhibited through their behavior? Person's attitude to be consistently exhibited through their behavior. तो मतलब एक पर्सन का जो एटीट्यूड है, ठीक है, तो अगर उसका एक एटीट्यूड है, द एटीट्यूड इज वेरी वेरी स्ट्रॉन्ग, देन यस। Okay, attitudes are more likely to change when the message is delivered by a highly credible source rather than from a low credible source. ठीक है, statement one right है. Statement two, messages that generate moderate level of fear are often effective in convincing people and can lead to attitude change. स्टेटमेंट टू को मैं गलत नहीं मानूंगी, ठीक है, स्टेटमेंट टू को मैं गलत नहीं मानूंगी। व्हाट डू यू ऑल थिंक, क्या करेक्ट हो सकता है इसमें? व्हाट कुड बी द करेक्ट ऑप्शन? क्या स्टेटमेंट वन एंड टू दोनों को हम करेक्ट मान सकते हैं? ओके, गुड। Which factor is not typically involved in the formation of attitude during the early years of life? Media. Which of the following conditions are crucial for the formation of groups? Okay, proximity. Okay, एक पैसेज है छोटा सा, ठीक है। Individual differences in human functioning underscore the rich diversity in physical and psychological attributes among the humans, from traits like intelligence and creativity to behaviors and emotions. This diversity is not only natural but essential, adding vibrancy to human existence, much like varying colors enhance the beauty of the natural world. Psychologists have long recognized and studied these differences, aiming to understand, measure, and predict individual behaviors and capabilities. Intelligence as a key psychological attribute illustrates the breadth of human variation. It encompasses the ability to reason, solve and problems, understand complex ideas, and adapt to environmental changes. Theories of intelligence, ranging from Spearman's notion of general intelligence factor to Gardner's theory of multiple intelligences, reflect the complexity and multidimensionality of human cognitive abilities. Similarly, other psychological attributes like aptitudes, interests, personality, and values contribute to the unique makeup of an individual. The assessment of these attributes through standardized tests, interviews, case studies, and other methods allow psychologists to understand individual differences deeply. These assessments not only aid in identifying personal strengths and areas for development, but also in predicting future behaviors and outcomes. Through the study of individual differences, psychology provides insights into the intricate tapestry of human nature, emphasizing the importance of diversity in enhancing the richness of human experience. What does the concept generally understood as general intelligence encompass? Specific talents, जनरल इंटेलिजेंस की जब बात हो रही है, तो एबिलिटी टू अडेप्ट, रीजन एंड सॉल्व डाइवर्स प्रॉब्लम्स, स्किल्स इन सोशल इंटरेक्शंस एंड एम्पैथी, या कलेक्शन ऑफ अनरिलेटेड पर्सनल इंटरेस्ट, इट इज द एबिलिटी टू अडेप्ट, रीजन एंड सॉल्व डाइवर्स प्रॉब्लम्स। ओके, या what theory suggests intelligence is made up of various distinct abilities? The idea that intelligence is a single fixed quantity, the belief in a singular emotion, और the which theory, देखो theory तो बहुत सारी suggest करती है, but the concept of diverse and specific intelligences. In a setting where different individuals excel in various disciplines, which concept of intelligence could explain the range of their interest? It is multiple specific forms of intelligence. How does the idea of a single overarching intelligence contrast? Uh, just a minute. Yeah, contrast with the concept of multiple specific intelligences. One focuses on emotional skills, the other on cognitive. One suggests a single ability, one is based on genetic factors and the other considers environmental. There's no significant difference. Both suggest the presence of various abilities. Single overarching intelligence contrasts with the concept. Of course, the one is based on genetic factors and the other considers everything. देखो इसमें ना you can have more than what should I say? More than one options also. Okay, according to you, whatever you feel like. Now, what could be the answer for this? What could be the answer for this? कि एक आइडिया ऑफ सिंगल ओवरआर्चिंग इंटेलिजेंस ऑफ कोर्स बिल्कुल सही है ठीक है now the last one is the 200th question is which of the following methods is considered scientifically valid for assessing individual differences in psychology consulting astrological charts no relying on personal anecdotes no observing horoscope predictions no it's utilizing the standardized tests okay so yeah thank you so much everyone we are done with the top 200 most important questions okay now इसमें से कुछ questions थे which we had done okay earlier but वो important है this is why we have discussed it again okay now I urge all of you to take a 5 minute break ठीक है take a break of 5 minutes just take a break of 5 minutes and come back again क्योंकि I am going to bring a paper okay now a paper of last year ठीक है लास्ट ईयर के जो स्लॉट्स में बहुत सारे स्लॉट्स में जो पेपर्स हुए थे ओके उसके कुछ क्वेश्चंस मैं आपके लिए लाई हूँ तो टेक्निकली वो सारे पीवाईक्यूज हैं ओके पिछले साल के ये राइट सो जो बेसिकली 50 पीवाईक्यूज हैं वो ओके 50 पीवाईक्यूज फ्रॉम ऑल द स्लॉट्स of psychology last year ठीक है तो you give yourself a break of 5 minutes and then come back again I will also come back okay so बेटा ये सेशन बहुत टाइम से चल रहा था ओके एंड ये 200 क्वेश्चंस आर डन सो यू कैन सी द रिकॉर्डिंग सी दिस सेशन लेटर बट कम आफ्टर 5 minutes आई एम बिगिनिंग विद अनदर सेशन ओके द मोस्ट एक्सपेक्टेड पेपर जो कि पिछले क्वेश्चन से रिलेटेड है ओके लाइक पिछले साल के क्वेश्चन से रिलेटेड है ओके so thank you so much everyone take a break of 5 minutes and come back again okay